Understanding supplements can be confusing enough when it's just you trying to figure it all out. But when you're trying to conceive or already pregnant, you really want to know that the supplements you're taking are right for both you and your baby. That's what we're talking about today on Lunchtime Live with the Center. Sharon Lavigne, research coordinator from MotherToBaby, is back with us talking about supplements and answering your questions as well. Sharon, welcome back.
Hi, thanks for having me.
Well, trying to get pregnant or being pregnant makes women question the safety and use for everything, including supplements. So, why take supplements during pregnancy?
Well, I think we want to focus first on vitamins as being supplements. So, the most important thing that probably all your viewers are aware of is that we want them to at least be on some kind of folic acid. Folic acid is a B vitamin and it helps reduce risk for birth defects. The recommended daily allowance in pregnancy is between 600 and 800 micrograms in pregnancy. So you can take a supplement that's just folic acid, or it usually comes in your prenatal vitamin. The prenatal vitamins that you get, if you go to Walgreens or CVS or whatever, and you're looking for vitamins, there's a whole aisle of them. So it's really hard to decide what should I be getting. The easiest thing, of course, is for you to ask your provider, your healthcare provider, is there a recommended product that they suggest or a prescription that they can give you? Because all supplements, vitamins included, are not regulated by the FDA. So we can never really be certain that what's on the label is what's in the product and whether or not there are contaminants or not. One guideline is to look for the USP label, and that stands for U.S. Pharmacopoeia, or the NL or National Formulary on the label. Those little symbols help us know that they're at least reviewed in some way, shape, or form. So we still can't be sure that they do what they say they're going to do in terms of whatever the product is advertised to help do. But certainly that would be a better place to start than just grabbing anything off the shelf. On our website, we have a nice prenatal vitamin baby blog that actually goes over which vitamins you actually do need to supplement in pregnancy and how much. More is not better. Some people think, well, I'm going to take more, that's better. And if you're taking several products, you have to look at each one and look at the labels to see, do the ingredients overlap? And you need to add, so if you're getting vitamin A in 3 different products, you need to know how much does it total to, not just how much is in each product. Vitamin A comes in different forms. There's a more natural vitamin A version called beta carotene. That's what you get when you eat a carrot, versus the retinol or retinoid version that in high doses can be harmful in pregnancy. So most prenatals nowadays come with only the beta carotene form of vitamin A, but that's another thing you can look for on the label. It'll say vitamin A and then tell you how much is beta carotene or fully beta carotene. So I think for prenatal vitamin, we want you to be on one if you can be prior to pregnancy, but look to your healthcare provider for some direction or some advice on which version or which product might be best for you.
Okay. So you said vitamins as supplements. What are other supplements that you may or may not include in here?
Okay. So I want to spend one more second on vitamins, and that is oftentimes a healthcare provider will run tests and tell you, gee, you're deficient in vitamin D or you're deficient in B, especially if you're someone who has an underlying medical condition that makes you not absorb vitamins and minerals properly, whether you have a altered diet that is either by personal choice a diet, or whether it's a medically chosen diet because of, again, for a medical condition, you may need extra. So your prenatal vitamin gives you what you need for pregnancy, but if you're already deficient in something, you're going to need to boost those particular deficiencies. And that's where your healthcare provider can guide you to say, okay, you're deficient in D, so you need to take this much extra D in addition to your prenatal vitamin. So keep that in mind, that based on your underlying health and medical conditions, you may need extra in the vitamin categories. And then when we switch gears to other supplements, which is really everything else, The herbal products have the same issue as we worry about with vitamins and minerals, is they're not regulated by the FDA. So again, you can read the label, you can read what's in there and still not be sure that that's what's in the product, or the dose that is labeled on the label is really what's in the product. We've had individuals who've been using supplements that are actually contaminated with lead, to the point where they're very high levels of lead, and lead is harmful in pregnancy. So that, it's not good when you're not pregnant, but it's even more harmful when you are. We can buy things online and they come from all over the world, and you're not sure what the regulatory processes are from those other sources. So you really need to be buyer beware and be careful of what you're using. Mostly, there's probably not a supplement you need to take. If you have a medical condition for which a supplement or an herb has been suggested to help you, then we can look at that information and see if there's evidence of it being harmful for fertility or pregnancy or breastfeeding. The problem is that there's not a lot of data out there. And most of the information on supplements has to do with not really birth defects, but it may interfere with hormones, which are going to be an issue if you're trying to get pregnant or stay pregnant. They may cause uterine contractions. They may cause clotting or bleeding, which are all issues that can complicate a pregnancy. So generally speaking, our recommendation is that you probably try to avoid those as best as you can once you are pregnant and while you're nursing, because there's not a lot we can really say for sure about any of them.
So on that note, are there supplements that are considered safe for pregnancy?
Safe is a tricky word, right? So people think that natural equals safe. So something that's organic or from the environment should be safe. Well, strychnine's from the environment, lead's from the environment. Those are things that can be very harmful. So I know a lot of our patients use ginger for nausea and vomiting. And, spices and things like that, if they're used in, amounts matter. So if they're used in amounts that you might find in cooking, they're probably not going to be an issue. But if you're taking a tablet that has, a really high dose of something, that's when we want to look into it more and be sure that it's not an issue. Licorice is something we ask people to avoid. Licorice can cause cardiac issues. Chamomile can have some components in it that are related to a medication called Coumadin, which is a blood thinner. And we wouldn't, again, dose is an issue. And I don't know from one person to another how much would be in each individual product. So I tend to lean towards being safe than sorry.
Okay.
So there are some out there. Kombucha. I know a lot of patients are drinking that. That has an alcohol content. It can be pasteurized or unpasteurized. Generally, we want things that are pasteurized, so you're not exposing yourself to, contaminants that way. And it also has a caffeine component. So if you're someone who's trying to watch their caffeine, that's another caffeine product to watch out for. Protein drinks,
Yes.
Again, stick with ones that have protein in them and not have a lot of other herbals and components. So if you're trying to do meal substitutions, you're having issue keeping food down, and the protein shakes are really helpful, great. But look at the label and try to find ones that just have, the amino acids and the proteins in them and not all the other ingredients, because that's when it gets hard for us to say whether it would be harmful or not.
Okay. So what about things like curcumin or turmeric?
Turmeric's big. Yes,
Yeah.
Turmeric's big. Turmeric has some clotting or bleeding issues that go along with that. Again, in spices and cooking, that's not a dose that should be a problem. The reality is too that, probably in some of the supplements, the dose is not necessarily going to be an issue, but we can't really be certain. Off the top, I'm trying to remember why women are using the turmeric now. What is it supposed to help do?
Supports inflammation.
Yeah. So
liver support.
we're not really sure that it does that, and does it do it for everybody consistently? Mm-hmm. That's the other thing, is that you're using something and you may actually not really be getting any benefits from it.
So sometimes when women are pregnant and they have things like nausea, you've mentioned ginger. I remember personally having nausea and taking Preggy Pops, and they were candy with B6 in them. I looked at the
Yeah.
ingredients.
One of the most
So at the same
yeah,
time, I'm wondering if that
the
if it's
B6 vitamin
more.
does help reduce nausea and vomiting. We use it in some of our, in a combination with another medication in our anti-nausea meds.
Okay.
So again, B vitamins are water-soluble vitamins. You can't really have a toxic level of those. So a B vitamin in excess in a pop, even if you're, having a couple a day or whatever, is still probably not going to be an issue for pregnancy.
Okay.
It may or may not work. So the issue is if it's not helping or you're still unable to stay hydrated, is you really need to seek out some other sources of ways to keep food down.
So is there anything that you can be taking to avoid that, like prior to getting pregnant?
Avoid nausea and vomiting?
Sure.
Well, every pregnancy is different,
Yeah.
and every woman is different in terms of how they react or not react. Some go the extreme. We call that hyperemesis, when they really are very dehydrated. They might need to have fluids in the hospital, that sort of thing, versus someone who's a little bit nauseous every day and it passes. I think if we can keep our blood sugars level, because when our blood sugar dips, we might get more nauseous. So when you go to bed and you're not eating for 8 hours and you wake up and your blood sugar's low, that might add to your nausea and vomiting. So that if you can have a snack before you go to bed that has some protein and has some sugar in it, that protein will slow down the metabolism of your blood sugars and maybe help you keep from being so low in the morning. Eating smaller meals, little bits at a time throughout the day to help kind of keep you from, your blood sugars fluctuating too much. And then to always, double check with your healthcare provider what other tips that they have in terms of your behaviors versus having to take something. But there certainly are medications that we use safely. And there are certain other remedies that people have found. Just be careful about the herbals.
So in general, herbals in food are mostly okay, would you say?
Yeah, the doses in that, I mean, we don't really study, different diets. If you come from a certain part of the world where, a certain spice is really heavily used, we don't expect that group of people to have a higher risk than, say, another part of the world where they don't use that spice at all.
Okay.
So, as far as dose goes, there may be some dose response issues.
Okay. So specifically for vitamins, are there vitamins not to take to be avoided during
vitamins?
Yeah, because we talked a little bit
vitamin
about
A in the retinal version is one that you want to try to avoid. You really have to take a lot before we worry, but with so many people taking multiple products, I worry that you've got your dietary source, which is going to be the beta carotene source of vitamin A. But if you're taking supplements that have multiple A in 3 or 4 products, you might be getting too much.
Yeah.
So you want to stick with, if you can, on the label, look for the beta carotene version of A.
Okay. Someone asked a question. You talked a little bit about protein supplements. What about Herbalife? I'm assuming that Herbalife is protein, but there probably are some other things. I've heard women drinking that.
I think, again, you'd have to read the label for the different versions of it that you're considering taking. But off the top of my head, I think they all have a long list of herbals in them.
Yeah.
Hence the name, right? So that would be one that I wouldn't really be able to give you a good risk assessment on, because I wouldn't be able to say enough about what the ingredients could potentially do.
Okay. There's one that a lot of people ask questions about, ashwagandha. Do you have any thoughts on that?
Now you're asking me one off the top of my head. I don't, in general, I don't remember. In general, of course, I would say it's an herbal. We want to try to avoid it. I don't off the top of my head know the answer to that.
Okay.
Sorry.
No worries. Another person, Magali, I believe, said very interesting, especially for women seeing naturopaths who recommend most supplements that you don't recommend using. Dosage is all dosage.
Right.
Yeah.
Right. I understand how that's difficult, that I'm basically saying I really I can't assess those. That doesn't mean they're harmful. It
Mm,
just means I don't have data in the medical literature that allows me to tell you the benefit outweighs the risk. And I'm not a naturopath, I'm not an MD, but I have to look at what's in the medical literature. And if I don't find evidence of, there's not harm, I can't say one way or another.
okay. And vitamin D deficiency, Magali says, vitamin D deficiency has been showed to be linked to miscarriage. How much should we take a day? 1,000 IU or more?
Okay, vitamin D is controversial in how much you should take. So I think the running amount right now for pregnancy is 600 IUs, international units, or 15 micrograms.
Okay.
The upper limit of how much vitamin D people would get in a prenatal or a vitamin is 100 micrograms or 4,000 IUs. If you're deficient, your doctor will advise you on what dose and how often to take it. Some people take it daily, some people take it once a week, to tell you how much extra to take. So you would take what's in your prenatal, and then you would take a supplement that's just D. Sometimes D comes with calcium in it too to help you absorb it, but not a lot of, try to find one that doesn't have anything else in it.
Okay. And can you tell everyone a little bit about what MotherToBaby does?
Yes. So we're a free service. That's the biggest, most important thing. You can reach out to us by phone or by email and ask us questions. If you're planning a pregnancy, you can ask the questions we've been addressing today. If you're asking about an over-the-counter product, I'm probably going to ask you to send me the full label so I can look at it and read it. And then of all the things that you're taking, so I can add them all up and look at them all together. We answer, of course, medication questions, infectious disease questions, workplace questions. So if you work in an environment and you're concerned about, you're in a dental office, or you're in a veterinary clinic, or you're in a nail salon, mm-hmm. or anything else for that matter, you work in an OR or a laboratory, we can help you with that. We have a reproductive and environmental occupational hazards clinic here at UConn, so we can help with that step as well. So really, we're not prescribing, we're not telling you what to do or what not to do. We're just giving you the information so you can make the best reproductive decisions for yourself, and hopefully go back to your providers with that information. So all of our center patients, the provider that referred you over gets the transcript of what you and I discussed, so that you can discuss it together about, here's the information. Is this something that I should continue to do, or is this something I should discontinue?
Okay. I do have one final question. In the role of like antioxidants, vitamin C's, things like that, are they okay for pregnancy also?
Vitamin C is a funny one. If you're taking a lot of vitamin C or too much vitamin C, specifically in pregnancy, the baby can kind of come up being deficient in vitamin C because it was used to such a high amount. So you really, again, let me look at my cheat sheet here for C. I might not even have that for C. Oh, C, upper limit is 2,000 milligrams, but you should be getting about 85 milligrams, which isn't very much. Of vitamin C. I know people like to push that when they're sick, or they feel like, geez, I want to protect myself from getting sick. But just maybe for short periods of time, that wouldn't be such an issue. But if you're going to, for continuously throughout the pregnancy, take super high amounts of C, you aren't necessarily doing the baby any good later, because babies come out showing signs of rickets, which is, deficiency in vitamin C because they were used to so much.
Yeah. So are there any supplements that maybe people would take during preconception to improve egg health, those types of supplements like CoQ10?
CoQ10, the center recommends. There's some debate currently about metformin. No, sorry. I'm blanking. On melatonin and whether that may increase. And melatonin, I wouldn't still be recommending in pregnancy for all the reasons we've already talked about. But if you're using it to improve egg health or quality, you're using it prior to conception. And so then the the actual fetus or the baby is not being exposed to it because you're using it before you transfer.
Okay.
So there's some evidence of that. Again, I think, that's an emerging recommendation. I do know that some of your patients have been told that and have been doing that.
And most of the time, they stop at or after transfer. So
yeah, yes.
Okay, and going through IVF. One last question: going through IVF and failed transfers are tough. Do you have a recommendation, or do you recommend taking magnesium to help with mood and depression, like feelings? And if yes, what kind of magnesium?
Great question. Maternal mental health is very important. Can't have a healthy baby if we don't have a healthy mom, and that includes mood. If you're feeling that the process is affecting your mood, that seeing a professional or seeing a counselor or somebody that can help you through that. Some people get by with, doing some talk therapy. Other people may actually need medications, and there are medications. Most of the psychiatric medications are not considered high risk in pregnancy. So I would say that again, because I can't speak to how much magnesium is good, bad, and maybe it doesn't work for you either, that to talk to your healthcare provider about whether or not there's a medication you could try to offset the symptoms, because the symptoms are gonna, sort of have a cascade effect on everything else about you, right? You might not be eating, you might not be sleeping, because it is so stressful.
And you mentioned MotherToBaby, what they do. I know that you have a study going on for COVID-19 on pregnant and breastfeeding women. Do you want to just mention that real quick?
If you reach out to me or you reach out on the website, you can enroll in our observational studies, and we're collecting information on lots of different things. COVID is one of them. Vaccine is another. There are other vaccines that we are collecting data on, and all the autoimmune diseases basically are ones that we're researching in more detail. So I know many of the center patients have other underlying medical conditions, many of which are autoimmune diseases. So if that's something you'd like to participate in, then certainly you can enroll yourself. You can reach out to us and we can help you get through to them if that's something you'd like to do.
Awesome. All right. Well, Sharon, thank you so much for being here. Thank you for sharing with us. And
thanks for great questions, everyone.
Yeah. All right. Well, again, the website is mothertobaby.org. Is that right?
Correct.
Okay, good. And our website is yukonfertility.com. And we'll see you next week on another Lunchtime Live with the Center. So
have a good week.
Bye.
Bye.